This is Bruce Jansen at the 36th Annual SDEF Hawaii Dermatology Seminar. I'm speaking with Dr. Larry Eichenfield of University of California at San Diego about new acne guidelines. Tell us what's new and different about these.
The American Acne Rosacea Society put together a panel specifically to come up with guidelines for pediatric acne. There's really no guidelines specifically looking at pediatric acne, and there's certainly issues that are different with our pre-adolescent acne as well as adolescent acne. Guidelines differ from some prior guidelines, especially for mild acne. There's a variety of choices of topical therapy, including benzoyl peroxide as a monotherapy, or topical retinoids can be used, or combination products can be used. The algorithm is set up to guide anyone, whether it be an expert dermatologist or a pediatrician, through what we think is appropriate first-line and second-line management for both pre-adolescent and adolescent acne.
That must have been a kind of heroic task, given that there are so few acne medications approved for young kids.
Well, it was easier for some of the adolescents because then the discussion's on label. And once we got to our pre-adolescents, pretty much all acne medicines are approved age 12 and up. There is some data emerging, but it came down to expert experience. The good news is that algorithm's pretty much the same for the prepubertal acne as adolescent acne. Most people believe that the medicines can be used in a similar way. Little bit difference with younger children with oral antibiotics. You can't use cycline-based products under age 8. So there are some differences. And of course there are differences in terms of where we may use hormonal therapy or some of the systemic therapies.
Are the guidelines at this point available online, and where do you expect to publish them?
Well, the guidelines were presented at the American Academy of Pediatrics national meeting a few months ago. They're not yet published or online. They will be, and they're not online basically because we're going through the publication process now. But very shortly they'll be readily available, and I hope they'll be useful to people.